In 2015 alone, over 127,000 Americans died from drug or alcohol-induced causes or suicide. That is 350 deaths per day, 14 per hour, and one person dying of a preventable cause every 4 minutes. Projections say it will only get worse. This heat map illustrates the number of deaths from drugs, alcohol, or suicide, with the darkest red states, such as Wyoming and New Mexico, signifying over 60 deaths per 100,000 residents. If this trend continues, 1.6 million more people could die by 2025, with New Mexico and West Virginia each projected to have almost 100 deaths per 100,000 residents. According to the documentary Heroin, Huntington, West Virginia is the overdose capital of the country. In 2015, Huntington saw 10 times the national average of opioid overdoses. There is available treatment, but only about 10% of people who need it will receive it. If you know someone struggling with a substance use disorder, you can have them check out the treatment guide on the National Center on Addiction and Substance Abuse website. Before getting people into treatment, preventing death from overdose is critical. Narcan is a medication that, when administered as soon as possible after an overdose occurs, it can intervene and block the overwhelming effect of the opioid's actions within the brain, therefore able to halt respiratory depression and help that person regain breathing. Some people question whether making Narcan more widely available will serve to empower addicts. Tara Tucker, a first responder in Winston-Salem, North Carolina, shares her thoughts.
The approach I take is you can't recover if you aren't alive. So I really take a harm reduction approach to it. We've got to keep people alive to help them recover, and that also means connecting them to the treatment options. So naloxone is just one piece of the formula. We're working on bridging the gaps too, to get into things like medication-assisted treatment programs and inpatient treatment programs, detox, based on that person's choice. So I think in Forsyth County, after that initial overdose, we're really trying to offer people a lot of different treatment options so that they can get the help. Everybody's different. Everybody's recovery process is different. So. Right now, probably more of them, it's after some visits. Right now, you have to think, when we give somebody naloxone, all we're doing is throwing them into withdrawal. So you're dope sick and you're worried about how you're going to fix that, right? And EMS doesn't do anything to fix that currently, nor does the emergency department. So I think we really have to bridge that gap first to help people think more clearly so they can really get to the treatment they need.
Forsyth County is located in North Carolina. Although the rate of opioid overdose deaths is less than in other counties, Forsyth County has also been hit hard by the epidemic, with an increase of 189 deaths from June 2016 to June 2017.
We don't see it with just one generation. We don't see it with just one demographic area across the county. This is one of those epidemics that really is affecting everybody. We run these calls with EMS every day, 7 days a week. We go to really great neighborhoods, we go to not so great neighborhoods.
It used to be the case that one dose of Narcan was sufficient to reverse an overdose from heroin, but now with more potent opioids, multiple doses of the medication may be needed. Another worrying fact is that syringes are often found to contain not just an opioid, but also a stimulant, such as cocaine or crack. This is called speedballing, which partly contributed to the death of Philip Seymour Hoffman and Glee star Corey Monteith. The number of cocaine-related deaths with opioids has risen substantially since 2012 and is only expected to increase. Why is this such a deadly mix? When you mix opioids with depressants, such as alcohol, the depressant effects, like slowed breathing, gets accentuated, thus increasing the risk of respiratory depression. When mixed with stimulants, such as cocaine, some of the stimulant effects, like increased heart rate, might cancel out the shallow breathing from the opiate. But the effects of stimulants wear off very quickly. So if you took a large dose of the opioid, thinking that the stimulant will counteract the negative effects, you may have an increased risk now of respiratory depression and thus overdosing. Sterile syringe programs allow users to obtain clean needles and reduce the risk of getting and transmitting blood-borne infections. HIV and hepatitis are two very prevalent infections among people who inject drugs, and safe syringe programs are one harm reduction strategy. They also serve to reduce needle stick injuries, help people get into treatment, help reduce overdose deaths, and can help save money. Forsyth County recently introduced this program.
So we have a syringe exchange program here in the county. As first responders, when we're running those calls, we're giving people that information. I know Public Health and DSS and our emergency departments also give out that information, so we can try to connect people to syringe exchange program and really work on preventing some of those chronic medical conditions that can occur as a result of their use, whether that's endocarditis infections, osteomyelitis, and it helps keep them out of the healthcare system as well. As far as medication drop boxes, we had 2 drop boxes 2 years ago. I think we're up to about 15 now across the county, so we definitely have expanded that, and that's definitely a huge thanks to our law enforcement partners and to pharmacies that have helped with that in Forsyth County. So I can say the task force has really stepped up a lot as far as education to the public. Every month we're offering some type of event where you can get education. A lot of months more than one a month, but different partners take initiatives to do that, and then we try to get the word out about those to know that they are available. We have a big one coming up in May that Cardinal Innovations and some other partners are doing on May the 30th. It's an all-day event over at Guilford Tech, and Kevin Hines, who's a national speaker, will be here. It'll be a focus on mental health awareness and substance use, because a lot of times both go hand in hand. Within our school system, we actually have a safe and drug-free school coordinator that is also a licensed clinical addiction specialist, and she's working to pull some community partners together. We actually have a subcommittee on the task force geared towards these kids. One of the things I'm excited about is that we're doing a camp for kids that are affected by opiate overdose, whether it's they've lost a family member or whether they've been taken into DSS custody because of substance use. So it's going to be a week-long camp, and the goal really is prevention. So helping deal with their grief or loss issue, but also educating them about other coping skills and educating them more on substance use and why they should stay away from it, so that hopefully we can stop the next generation from following the paths of their family members.
So family has to recover as well. Myself, I'm 9 years in sobriety, but when I was in active addiction, my family was up here while I was down here, right? So once you get into recovery, the individual like myself starts progressing in life and doing well, and we come up here. The family's still stuck in that same spot because they were enabling, and they don't understand the whole recovery process and what you're going through when you're in treatment. So to have successful outcomes, not only does the addict need to get into treatment, but you have to have the family in treatment as well, because it's a family disease. Everybody, one person may use, but everybody is caught up in that addiction. So it affects everybody, and it affects everybody differently. My children needed the support for recovery. They needed support from the trauma and the PTSD and the issues I put them through in my active addiction. So to have everybody be successful, my wife, everybody has to meet, everybody needs to get support and have that to have better outcomes and better success rates in recovery. Even day to day, it's something you have to be working towards as a family day to day. You got to talk about it. You got to be open about it. Communications is our biggest success to treatment and recovery that we could have.
So in Forsyth County in particular, I think law enforcement has done a really good job working with EMS, and with our community paramedic, our mobile integrated health team, law enforcement officers can now call us on scene when they feel it's a mental health or substance use issue. So I think if they feel the person really does want treatment, they are more willing to try to help get them the treatment and contact us to work on that piece of it than they are just to send them to jail. I think they all have seen we're not going to arrest our way out of this problem. and it's much better to get people the help that they need. Some of that's going to vary. Some of that's going to
vary
vary officer to officer, but as a whole, we're doing a lot. I think a lot better job than we were at getting these people connected to treatment instead of just arresting them.
Trust for America's Health is calling for a national resilience strategy. If you would like more information, please read their Pain in the Nation report. We all need to work together comprehensively to resolve our nation's problem with drugs, alcohol, and suicide. And thankfully, we have begun making those necessary steps.